Look forward to this every Friday. Our next guest is going to be Dr. Bridge Bomby, new sponsor of the Richard Bean Show here. He is from, Central Cardiology and Centric Health, the premier leader of health and medicine in Kern County. We've been talking to him about the resurgence of the coronavirus and what we do. After Dr. Bomby, Mike Armendariz will be on. Of course, Mike joins the show every Friday to talk about entertainment. We got movie theaters reopening. We got new content coming to Netflix and Amazon Prime and HBO and Showtime. Mike brings us all up to date. Let's get right to the topic of the day. If you follow this program, you know Dr. Bomby is a regular. I love having him on because he makes sense in a very sober and analytical way of the threat we're facing from this virus. And I'm just speaking for myself, and I had this conversation with Trevor Horn. If you're just joining the show here, I was letting down my guard. I thought that by the time we got into July, that this country would be much farther along. I thought for sure we'd have baseball back. I thought for sure I'd be driving down to Chavez Ravine to see the Dodgers play. And it looks like a whole different story now as this virus comes storming back. Let's welcome back to the show Dr. Bridge Bomby of Centric Health. Dr. Bomby, how are you, sir?
Richard, I'm well. How are you?
I'm doing terrific. Thank you again for joining us on this Friday. Dr. Bomby, you heard my intro. Maybe I was naive. I just thought that at least it looked like the numbers where we are going from the vantage point of living in California were going in the right direction. And damn if it doesn't look like we're going in the wrong direction. When you look at this as a medical practitioner, what do you see?
I see a predictable behavior. We knew the virus is there. We knew the vulnerability is there. We knew only a very small fraction of the population has been exposed. So what we have repeatedly reinforced on this show is that the caution is the word. You have to lean towards caution and not be cavalier. You become cavalier, you invite the virus, and it's going to grow exponentially. The whole idea about learning the viral behavior was putting those techniques to use. If you don't put those techniques to use, you let the virus proliferate like a raging wildfire, which is where we are now. So it's important to understand what exponential means. So Richard, if you start with a single person, and that person yields infection to 3 people, the 3 become 9 in the next go-around, 9 become 81 in the next go-around, 81 become a little over 6,000 after that, and the next go-around after that is 43 million. So to go from 1 infection to 43 million, all it takes is 5 or 6 multiplications in a 3-day period. The exponential growth, so the numbers now are really large. When you have 40,000 new infections a day, new cases a day, you can easily add another 5 or 6 times of the patients who actually have the virus. So if you have 300,000 to 400,000 new infections a day in this country, that becomes an uncontainable situation. What we did earlier on was we had the flattening, we had the lockdowns, and that helped flatten. That just gave us a ramp off a slippery slope. Our job was not to go back into the slippery slope. By not following what is necessary, the safe distancing, hygiene, masks, we are just inviting danger, it's a little frustrating to see that we have squandered away the gains of the lockdown.
When you say uncontainable, uncontainable means, pardon my French, but we're toast. How can we, going forward, when you're starting with 40,000 new cases a day, and then with the multiplier effect, maybe as many as 300 to 400,000, how are we supposed to deal with that? What's the prognosis then?
So the backstop, Richard, I have always encouraged that we need to have herd immunity built through controlled infections. And to control the infections, you have to do what we have preached all along: masks, distancing, hygiene. You have to do that. If you don't do that, what you do is you expose yourself, but more importantly, the infirm and the old, as you said, in our population, to the risks. It's a numbers game. When the numbers reach a certain threshold, it becomes an uncontainable behavior. But even then, we just can't say we're going to give up. No, we can't give up, because if we allow the infections to continue to spread at a rate, they will eventually, in the next 2, 3, 4 weeks, will convert into hospitalizations, into ICUs, into deaths, and they will displace other non-COVID related healthcare, which is horrible. So the elective surgeries, which also I consider a flawed terminology. There is nothing called elective surgery. It's a continuum. It's a spectrum. The elective today will become urgent a week later, and emergent 2 weeks later, and fatal 3 weeks later. So this is a part of the continuum. It's not like elective that you are going to do dental cleaning or something.
Yeah, right.
So you're pushing, as of now, some numbers suggest an equal number of people died waiting for their non-COVID care because of the COVID fear and the COVID hospitalization needs. So we need to make sure the surge doesn't completely obliterate the hospital capacity in favor of COVID, and we add non-COVID deaths to it. And then the economic consequences. If you don't have a workplace where safety is ensured, you're not going to have productivity. You will not have customers. So it's all ties up. It's individual responsibility. There is no substitute for individual responsibility. We all are participants in this battle. We have to fight it together.
I think we're talking to Dr. Bridge Bomby. I mean, Dr. Bomby, when you talk about this being uncontrollable, and it seems to me we're almost there. And one of the effects would be, as you said, that if we are stressing the hospital capacity, then people can't get treated for other non-COVID related ailments or whatever, and you may have deaths on your hands there. Let me ask you this. What is it? You immigrated to this country when you were 25 years old, I believe that you told me. What is it about the American experience or the American character that seems to be so skeptical about this, so resistant to conforming to this? I talk to people who tell me, well, they're not telling us, the government's not telling us the whole story. I believe there's a virus, but I don't believe it's as bad as they say. From your experience, what is it about us, the Americans, that it's hard to get us to pull together in a pandemic like this? Is there something about the American character that is hard to corral?
I struggle with that because people like me who have been in science, we are data-driven, we are fact-based. Our decisions are based on facts. So when you have the same data, same facts to somebody else who has complete disregard for that and treats it in like a conspiracy or has no trust or faith in that, that's really a challenging proposition. And we see more here than I would say in several other countries, a variety of reasons. And part of that is that our values of freedom. But our values of freedom have maybe gone a little bit dystopian because our freedom, a person's freedom, can't encroach on somebody else's freedom. There's a boundary to it. I think there is some expansive view of personal freedom that encroaches upon others, and that kind of sabotages the complete meaning of freedom. You can't have freedom that encroaches upon somebody else's and call it a free land. And that also is in a paradox. with the underlying theme of our country, which is beautiful, the country of laws. When the laws, or in this case, the evidence suggests, go this route, there is no reason really to have a counter argument, political or otherwise, that is to the detriment of the society. That's going to have more people are going to die of it, and the economic damage will become more structural, longer, and more sustained. So I don't see a win-win situation by arguing against the virus. The quarantine fatigue is a fatigue not shared by the virus. Virus is tireless. It's waiting in the wings.
Quarantine fatigue and the virus is tireless. Well put. How would you, when you look at the government's response in terms of the critics of the Trump administration say this administration has washed its hands of this because they don't like the idea of bad news, whereas they should have gotten together and had a more cohesive national strategy, a testing strategy, or something that brings together states, that this thing has been farmed out for the states to handle, and that we could be doing a much better job. What do you say about that?
I think a coordinated federal response with active buy-in by the states and the local communities would have been the best template, because you have the best practices and you disseminate the best practices and course correct. If somebody has better ideas, you implement those and incorporate those ideas in the whole. When everybody's trying to invent the wheel, it's not a very constructive scenario. I would have liked a coordinated central approach. And again, I don't like to mix politics and medicine. I would have much rather the medicine part be kept totally separate from the politics part. When we politicize, and I said before, the virus is agnostic to your political views. It has no use for your convictions.
All right.
It only has use for your susceptibility, and that abounds.
Oh man, quarantine is agnostic. If you're, is there any indication when you see our local numbers, like we had a high today of another 118 people being infected, no more deaths, and this number has been, I mean, we went for a long time. It was 10, it was 12, then it got up to around 20. Now it's routine to be in the 80s. Today it was 118. Does that alarm you?
It's a source of concern because I don't want to indulge in alarmism or complacency. What I like to indulge in is what is the effective way of dealing with it. It puts a fear of God in me that the numbers are increasing and we will be, again, compelled not to do non-urgent or non-emergent care. And that puts stress and strain on everybody. The good thing about the current expanded infection rate is it's affecting this more so in people 18 to 44-year-old range. Mm-hmm. The good thing about that is they're less likely to be sick. And also the modalities of care, both outside the hospital, inside the hospital, and in the ICU have improved. That will favorably impact the length of the stay in the hospital. They'll favorably impact the mortality equation. So we have made progress parallelly as the numbers increase. But the whole idea was to contain the spread so that the demand and supply doesn't get disrupted like it was in New York to begin with.
Right. And Dr. Brahmi, when they talk about, I think I heard Dr. Fauci say the other day that we, if everything falls into place, perhaps we'll have a vaccine maybe by the end of the year. My question for you is, what does that mean? How long, when you have, 7.5 billion people on the planet, you got to get a vaccine to everyone. What does, if there is a vaccine breakthrough at the end of the year, practically speaking, when might we have access, the normal person have access to it to get vaccinated? What does that rollout look like?
to have a perfect vaccine has to have too many good things. So for the number one, it shouldn't hurt a person who's getting the vaccine. That's called sensitization. So you can't have hyperimmunity to a person who's given the virus. That happens, the anti-vacciners will have a field day. It's very important the virus is effective, efficacious, durable, and there are no side effects to it. And that's a high bar to achieve. Let's say you achieve that bar. Then the next point you ask is scalability of it. The scalability is a formidable challenge, and but what the companies are doing is that they are building 2 billion dosages as the virus is being tested. So if the virus fails out, it fails out to throw the 2 billion dosages in the sink. But if it pans out, you have ramped up capacity and availability on day one. So that's something they're attending to all the tangibles and intangibles in a concurrent manner, so that when and if the results are favorable, it's available on a mass scale. So that's encouraging.
Okay. And in terms of, we'll wrap it up here, in terms of your advice going forward, should I be in the mode of where I was at the 1st of April, that, I'm shutting down, I'm not going anywhere, I'm not driving my car, I'm only going to the grocery store every other week, and because I think it's human nature, we've all kind of gotten a little, as you say, quarantine fatigue. What would you advise us? What should be our war footing right now?
The message is how the infection is being spread right now. The infection is being spread through the homes. Most of the infections occur at home and they go to work. Also, the bars, the crowded spaces, indoor spaces. So yes, you have to decongest. You have to follow all the distancing and hygiene rules, and limit contact with people. And that means no home parties, minimizing the visits to grocery shop, minimizing the trips to restaurants and things like that. We are not out of it. So Richard, nothing has changed. The virus is new. The vulnerability abounds. Nothing has changed. All we did was we had an extended lockdown period to suppress the first surge.
Dr. Bombi, you said a couple of weeks ago, which kind of jolted me, and then I got it. You said, we're still early in this. And I think most of us want to believe that we've got a couple months of sacrifice, and maybe some people haven't seen their parents or whatever. It seems like an awful lot of sacrifice. But are we still early in this fight?
Very early, because the best estimates are 5-7% of the people in the country have had the exposure to the virus. So that leaves 90 to 95% under the best case scenario exposed. That's not talking much. You need 70% or more people with antibodies, either through vaccine or through infection, for you to have herd immunity. No, we are in the very early inning of this infection. And my concern all along has been when people somehow minimize the risks associated with the virus, call it a flu virus.
Right.
They minimize they attenuate the threat perception in public mind, and public becomes more cavalier. I much rather have the cavalry ready than be cavalier. I think we distort the message when we minimize the lethality and the virulence of the virus.
So well put. Good way to end it there. Dr. Bridge Bombi, everybody comes on every week at this time. Dr. Bombi, thank you so much. I hope you have a terrific weekend, friend.